My name is Lieutenant Junior Grade Bobby Bradford. I'm an ICU nurse aboard the USNS Comfort. My role on the ship is I'm an intensive care nurse. When patients come aboard that are critical, they come to the intensive care unit, might be on a ventilator or several vasoactive drips. My job is to care for them, execute the physician's orders, and try to get them healthy as soon as possible. Some of the biggest challenges are just the number of patients. Working in a new area on a ship is different than working in the hospital. We're providing excellent care to all the patients. We're split into 4 different teams. Some of the units are COVID positive patients, some of them are COVID negative patients, and we try to group the people who are on the ventilators together just because they require a higher level of nursing care. Well, my role as an ICU nurse directly impacts the medical mission. Nurses have the most hands-on patient care. Physicians make the decisions, but nurses execute those decisions and are at the bedside 24/7. So I would say all the nurses aboard the USNS Comfort provide a significant role in the medical mission. We're providing excellent patient care to as many patients as we can, but we are taking as many COVID positive, COVID negative to try to assist to take some of the burden off the hospitals in New York City. We are doing everything we can, working around the clock without days off, just like the other healthcare workers in the hospitals in New York. So, New York is in the middle of a crisis. They're in a fight, and I'd be the first to volunteer to come back and help out and do what I can. Being in New York City on 9/11, it led me to join the military. Even though I enlisted in the Army and spent 11 years as a combat medic, multiple trips to Afghanistan to try to make the people responsible pay for what they did to New York City on 9/11. And it's bringing everything full circle, coming back to New York City as a Navy nurse in a time when New York City is in a crisis again, and to be able to help the people, the citizens of New York City, and help them out medically as a Navy nurse. Since this is my first time back to New York City since I left almost 20 years ago. It's good to be back and helping out.